basic question we can ever ask is, are vaccinated children healthier than non-vaccinated? And if so, where's the research that proves this? Okay? We've got to understand, this is Claire, she's now 7, Cameron is now 5, and Aiden is now 2. Busy household. Definitely. And they're not vaccinated. And if you look at my experience raising my children, I am the primary health giver of my children. Okay? I decide what goes on and what doesn't go on. My wife is a nurse. She was a coronary intensive care nurse for a decade in one of the major hospitals in Des Moines area. What's really interesting is when she was pregnant with her first child, guess what? 11 of her coworkers were pregnant at the same time. All due within a 4-month period of each other. Amazing. Just amazing. Something was in the water. Okay? But this type of scenario is perfect for me to lead a little case study, right? Because throughout the years, my child's the only child out of that whole dozen that has not had any medications of any kind. She's never had an ear infection. 75%, no, all of those children but my children in that whole group of a dozen have had multiple rounds of antibiotics for ear infections. 75% had ear tubes before the age of 2, which goes against the American Pediatric Guidelines, I might add. Now, if you know anything about nurses, nurses have the best health care available in our society, don't they? You know why? Because they talk. They talk. They know who the good physicians are to bring their children to, and they know who the bad physicians are. They know who the bozos are to stay away from. So they talk, and they talk about their sick kids a lot. My wife didn't really understand this concept until she realized that, she really couldn't relate to her coworkers because they were always talking about their sick kids. Isn't that amazing? She never had any sick kids, and her coworkers are kind of patronizing. They're like, "Oh, you're so lucky. You don't know what we have to put up with. You just don't know." And you're right, we don't know. You're so lucky. That kind of made me a little ticked off. Being a chiropractor, I know where my child's health is going, and I know who's responsible for it, and I'm responsible for it. It's not luck. So the perfect thing happened. We got pregnant again. 9 of her coworkers were pregnant at the same time. Tell you, estrogen in the water. It's the same exact story. Except we have had 1 ear infection, lasted 4 hours. That's because I had a little 4-year-old dictating his health care to me. Third one comes along. 5 of her coworkers are pregnant at the same time. What's going on here? Can I be that lucky? How many of you here are not that lucky tonight? You've struggled through ear infection after chronic runny nose and sinus infection, blah, 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 blah. We just don't have those problems in our household. So you got to ask the question, what the heck am I doing so right versus what maybe are you doing so wrong? Part of it is we haven't vaccinated our children. Another part of it is we look at health care as something that's applied all throughout their life. I'm a chiropractor. I can adjust my children, and I have adjusted my children after an hour after their birthing process. Every week they get checked because I can. That's something that I'm blessed with. Although I, paid in education and tuition and all that type of stuff, it wasn't free. But this is what I became a chiropractor for, is because I could have my children grow up the same way I grew up, because I wasn't vaccinated as a child. And most people say, "Well, how'd you get through school?" Well, I don't know. I got my doctorate. I just must have fooled them all. No, but those are my kids, and that's why I make the decisions I make. There is a difference, and if anybody from the DHS is here tonight, there is a difference between a parent who is really neglecting their child versus a parent who's looking over the long-term interests of their child and health and safety. That is something that if I'm going to hammer home tonight to you, it's going to be big and bad because we're going to go over a lot of information. The DHS judges rely on the medical establishment to tell them what's what. But they only told them half the story, just as you have received half the story. Tonight it's going to be a little different. For instance, there's no proof that vaccinated children are healthier. There's been no major study that compared vaccinated versus non-vaccinated to see which is healthier. And if you're going to do a study, you're going to do a study with a group of vaccinated children and non-vaccinated children and get the statistics from that. And in Iowa, there's 3,400 registered non-vaccinated children within the school system. So the epidemiologists know exactly, who's not vaccinated and who's vaccinated because they have to keep tabs, right? But there's no major study.